Hi, my name's Melissa Bell. I'm an Iowa Wesleyan student. I appreciate you taking the time today to help me with my project. This is for a counseling class I'm taking. This is not an actual counseling session, so please keep that in mind. I ask that you find something that you're passionate about and speak 3 to 5 minutes about it. What would you like to discuss today?
I'd like to talk about abortion. I know there's a lot of people who are for abortion, and there's some that are against, and I'm kind of in between, and I feel a little frustrated with sometimes with people who are completely against it, because I feel that sometimes you need to look at the circumstances before deciding completely if they should go through with it or not.
Okay, so I hear that you are just having some difficulty with people who may not agree completely with you.
Well, not necessarily agree with me, but maybe just be a little more open-minded on how, depending on what circumstances or how does the person, got to this position, that they should be more open-minded to maybe there are certain things, like maybe when they're ill, or maybe if they were violated, and kind of things like that, that they should be more open-minded to that, as opposed to just strictly saying no, just have the abortion. Not have the abortion because it's still a living child.
I see. And so how does that make you feel when they don't necessarily think a person should have the abortion because of those circumstances?
Well, sometimes it does frustrate me, because when a woman is violated, that is just a horrific thing there alone. And then I know that people are like, well, you can go through the pregnancy and give it up for adoption, and then somebody else can raise it, so you don't have to be remembered. But when you're pregnant, you have that child in your body. They're growing inside for those 8-9 months. That alone. That's, to me, that would be just horrific if it was something that came out of a something like that, of a traumatic violation. So I just feel a little frustrated that people should be more open-minded and stop and consider the circumstance before they completely just tell people that they can't have it, or that they shouldn't have it done.
So what I'm hearing from you is you want a little bit more sympathy shown to those who may not, that may have circumstances surrounding their pregnancy that had a little bit more of a traumatic event, that a pregnancy that was derived from a traumatic event, maybe? Is that right?
Yeah, that would be one of the main reasons I would maybe consider, if I had to choose, or if I had a friend or someone come and ask me. It'd be depending on if it was from that, or it could be medical reasons too. Sometimes the pregnancy, you can start a pregnancy and find out later that you're having medical issues, and that it'd be your life in danger. That would be something too that sometimes I don't think people realize and take into consideration, that it's not because we're not wanting to have the baby, or that we're not thinking that it's a live thing, but that it's for medical purposes as well.
So you feel frustrated from people who may be otherwise closed-minded, you said, about the circumstances surrounding the pregnancy. Is that right?
Right. I just think that people need to try to be more open. Sometimes, again, it depends on the circumstance, and not saying that right away we should be like, oh, okay, you got violated, let's go ahead and do it, because it also depends on the person.
Mm-hmm.
But being open-minded and being more patient, as opposed to just already saying and strictly saying yes, do it, no, don't do it. I think we all are pretty much aware that the babies are alive in there, but
Right.
considering the circumstances is what needs to be done, I think, sometimes.
Okay. Well, thank you so much for your time today. I appreciate you giving your opinion on that matter. Again, I appreciate your time. Thank you again. Have a good day.